Good evening, this is MELDITA and I'm back. And our topic will be hemodialysis, inpatient or outpatient or home dialysis. Inpatient for those patients that are already admitted, or outpatient, this is walk-in patients. And home dialysis, but they are trained to do so. Two people will be trained. The operator is the patient and the assistant. And they need training for that. So before anything else, before dialysis, there are things to consider. We have to consider the preparation, that is gathering all what you need, and fill up or priming, recirculation, connection, and the start of dialysis. So as you see here, I draw this picture, and actually this is a hemodialysis machine, and we have 2 liters or 2 bags, 1 liter each of sodium chloride. That's the one on my left and the one on the right. And that one is actually connected to the venous tubing. Okay, so there is also this bicarbonate. It's already hooked. We have the dialyzer. We have the reverse osmosis unit that is actually goes with the dialysis machine. It's connected. I drew it separately so we can see better. And then we have also the acid bath. Okay, that comprises many electrolytes. And we have the glucose in there, acetic acid, the sodium, potassium, chloride, magnesium, calcium, and the ones I just mentioned. Okay, so here there's good water supply. It goes to the different filters. Water gets into the reverse osmosis unit where there is a semi-permeable membrane to filter more the water. So bugs, dirt, virus, or bacteria will be all filtered. Only purified water will come out, and that goes to the machine. And then we have this special kind of tubing here. It comes in a pack, the arterial and the venous tubings. So I will remove this tubing from the patient because it's already connected. So let's take them all out here. So this arterial tubing is actually connected to the 1 liter of sodium chloride. Okay, so this is the tubing, and it is supported by this clamp in here. That is supported by the clamp, and it goes up here. There is a little bloodline guide, and there is this transducer connection. This is a transducer, and this is actually the sodium chloride. It's up in here, it's clamped, and actually that will be primed later. And there is this, the blood pump in here. Okay, and after the blood pump, we have this heparin pump here. Right here, that is the heparin port here. There's a pump. Okay, and that arterial tubing extends down here, and at the end is actually a connector to the dialyzer. Okay, for the blue tubing, I will remove again from the patient. Okay, I'll take this out. That is actually connected to the drain bag. So if you see, that's a drain bag. And then this drip chamber, actually this is the air detector, is inserted into the holder in here. And the tail part goes here, and it is also into the clamp. There is also a venous transducer connected here. There are some other tubings that are clamped. And this special kind of tubing in here is connected to the dialyzer, and this is the blue port. Okay. So we have this fluid tube. These are the dialysis tubes. So the dialysis tubes here, blue, that is from the machine to the filter or to the dialyzer, going here at the bottom. This is located the connection. And we have also this arterial fluid tube that is connected to this part in here. So actually the blood goes down to the hollow fibers. We all know that there's diffusion and ultrafiltration. And then the dialysis goes up. That is the mode of mobility of this dialysis. It goes up as the blood goes down. Okay. So that's the filling up now is, as this is opened, that is where the arterial line is connected. So the fluid gets in you know, and you notice air and everything in there. So fluid comes in, it goes to this, actually this is the final position of this dialyzer before dialysis, but actually it is actually down. So it goes there, and then the fluid is picked up by this tubing. It goes to the chamber. More air will be tapped and everything there, okay? And it goes to this drain bag, because we're not ready yet for hooking up the patient. And the heparin, as usual, is already primed. The sodium chloride remains clamped, okay? And I guess that's about it. So when the patient is still being worked on for the connection, it could be either the fistula or the permacath, or it could be a temporary line from the groin, or those people at home. So they will recirculate the fluids. So this fluid is gone. This is for priming, and this is for fill up in priming. This fluid is for recirculation. This fluid is for recirculation. So that is being turned on. And the arterial and the venous tubings are actually connected via this clamp, as this is also open. So once the access is ready, they close this fluid, and they start connecting this tubing to the patient. So the arterial first will be connected to the patient, and that is closer to the anastomose area, the vein in the artery. And the venous part is also connected to the patient distally from the anastomosis area, okay? And that's how the connection is. And then this fluid is actually used for, you know, sometimes if pressure drops and everything, they could use this one and to back up for bolusing or anything, or they could just deal with ultrafiltration, whatever. So this is the job of the renal nurse. And actually, we have also here this panel. This is the computerized panel. And it tells all what they have to do and everything in here. And for those people that are going to be doing the home dialysis at home, they usually undergo training in the hospital. And it should be at least, the main operator should be at least a patient, and there's an assistant. Anything happen, they both know how to deal with the problem. And that is for the home dialysis patients. And the renal nurse will do her thing, deal with all the problem and everything. So for me, this is just, I am not a renal nurse, I'm a cardiac nurse, and I have an idea, but I'm just sharing you my idea, and I hope it will help a little bit. And probably this is now my last topic for the renal system. Again, guys, thank you so much for bearing with me. Thank you. Bye-bye.